Hi. One of the things I hear a lot is women come and they are experiencing pressure and heaviness, and they're not really sure what that's from. Sometimes, a lot of times, it's after babies. They all of a sudden have started to feel this heaviness and pressure. It's actually a common experience as well for women who lift very heavy weights, and maybe you're a high school or college athlete, and you've continued that athletic inclination throughout your adult life as well. So those are the kind of two populations that really start to experience the heaviness and pressure symptoms. And it's with those symptoms that people are like, why am I feeling that? And you might not even really pinpoint it. You might just be able to say, like, something feels really different in my vulva, in my vagina. Maybe something feels like it's in there. Sometimes people say, like, they feel like they're having air pass through their vagina. It's often called queefing. Sometimes you feel like you are dribbling pee when you stand up from the toilet seat. These are all indications of what's called a pelvic organ prolapse. Now, if you Google that, it has like a terrible inclination and rabbit hole that you can go down on the internet. And I really advise people not to, and you should really speak with a healthcare professional and really a specialized pelvic floor physical therapist about pelvic organ prolapse, or a urogynecologist, because in like the fact of the matter is there is some degree of descent of the pelvic organs after you deliver a baby. Maybe the only exception is if your uterus is a different angle and doesn't lay on your bladder. Sometimes they're called a retroverted uterus. So sometimes with those, you don't necessarily have some descent. Sometimes this descent, this pelvic organ prolapse, sometimes these can improve. There's different types of prolapse. There's bladder coming in, that's called a cystocele. There's the rectum that can come in, that's called a rectocele. Enterocele is one of them. There are a couple others that are way less common. And what this means is that you have your vagina, so if this is the front wall and this is the back wall, it just, the walls get a little saggy. That's all they mean. And sometimes that sagginess is felt as pressure and is felt as heaviness. Sometimes it's the cause of incontinence, so losing urine. Sometimes it's the cause of losing stool. So there is so many techniques that we can do to help reduce these. Sometimes the prolapse might not go up into its own. Sometimes it might not heal all the way, but there's 1.5 million things you can do and be aware of in order to help prevent it from getting worse. I really used to stress about whether, when I was doing a pelvic floor exam, if I should use the word pelvic organ prolapse, because when people get that diagnosis, they tend to go down this negative spiral of feeling really, sometimes people feel like a failure when they have this. Sometimes people feel like it's just like there's no options. They just are going to have to get surgery. Life is going to get terrible. All their organs are going to fall out. People can feel really bad about this, and really there's no reason to, because if you look to your neighbor probably has a pelvic organ prolapse. Maybe there's some descent of the organs, right? We all get saggier. We all start to droop a little bit as we age. And there's just so much you can do to help with the symptoms of it and help prevent it from really stressing it, so you're not putting yourself at risk for getting worse. So I wanted to throw that out there. I think it's just really important for people to know that what those symptoms of heaviness and pressure are, and really what you can do about it to help things start to feel better. So that's that. You should consult with a pelvic health PT, someone that really specializes and understands the symptoms of heaviness and pressure. And there's just so much you can do naturally, so you don't have to use drugs and surgeries to stay continent. And if this was only treated in early postpartum, and I mean early being like 5 to 10 years, I think we would save a lot of the postmenopausal problems where women are having incontinence and different issues in menopause. So if it was only diagnosed earlier and really helped people earlier, I think there's so much that can be prevented and at least prepared, so your body is already appropriately compensating for what's there. So I hope this is helpful, and if you are sitting on the fence and have known you have heaviness or pressure and maybe you just couldn't put the word on what that feeling is, hopefully this is good information in order to help you get help, because there's so much you can do and you don't have to live with that annoying sensation. All right, talk to you guys later.